A couple of questions I had for you is the data in terms of 30% of the 12 to 17-year-olds getting vaccinated. I was curious, is that national or is that local? And then the second question I had for you, which is a concern that I have from a lot of parents, and again, I think one of the things that you and I are probably hoping to do in this discussion tonight is, even if there's a few people that we can get to get their kids vaccinated, that'd be great. It's a win. Of course, parents do have some good concerns about the side effects of these vaccinations. I've certainly had parents asking me about any kind of long-term effects that we're not aware of. We haven't seen what this vaccine does for long enough to know if it's going to cause any problems to my child. I've had parents ask me, is it going to cause any issues in terms of their reproductive abilities? I've had parents ask me about, blood clots. So I was wondering if you could just speak to those things.
Yeah. So yes, yes, I think every time vaccination comes up, I know I'm not like we do our kind of vaccination, but it's very important. Childhood vaccinations are so important. Like if you think back, when you read about how many children died from cholera or how people became whatever from polio, when you think of those numbers, the morbidities, it's like, it just boggles the mind. I mean, vaccines are so important that yes, being worried about side effects is definitely important, but it's like, I think where people do feel nervous is the fact that the vaccines came out so fast. That's what I think makes people very uncomfortable, that it came out within less than a year. They started making it in March and they rolled it out already into arms by December. So that was really fast. But I think the point is that the science behind it is very solid. It's not the first time that these vaccines have been made. They've been made for Ebola and other things. So I think the mRNA science itself is not new. So for that reason, it's not something that, it's just like we're just taking something with nothing. And there is this effectiveness that has been shown 96%, 98%. I think even 88% is pretty good. So those things are all there. And then the side effects, yes. I think all prior vaccines used to be, studied for 2 years, 5 years. Here, there was no time. There is no time. So I think what they saw, like the short-term effects, we definitely know is like when they gave the vaccine to the children, and I think the antibody response that was seen was similar to that was seen in the adults. So they saw the same, but the reaction was no different. I guess they were all reactogenic. It's the same thing that I had some reactions too, like you had some local pain, you had some axillary pain, you had some fever, some myalgias for some time. It all was self-limited, went away within less than 24, 36 hours. So I think those were the least kind of symptoms. I think there has been a lot of press about, so it's kind of like you have to take things in numbers, because there was this description of the myocarditis that was described because of the Pfizer vaccine. So I think that was kind of interesting in the sense that myocarditis is not just seen because of a COVID vaccine. Myocarditis is something that is seen from many different viruses, and mostly it's seen in more boys, young boys. So, but then the number-wise, the way it was is like, I think the number they showed was 36 kids in a million got that side effect. So it's like you have to see, and symptoms were mild. None of the kids were, like most of them resolved by simple like non-steroidals or colchicine. They didn't need any severe medication. So I think those things the side effects are so minimal that I think there shouldn't be so much hesitancy. It's like, my kids took it, they didn't have any problems. They just did fine. But the number is so small. The 36 in a million is so little a number. And I think there's one slide, if Vidya can show me the last slide that was on my talk about myocarditis. It just puts it in perspective, like how many things you prevented, the hospitalization numbers. I think I have them, if it's a problem. It's like for every, for like if there was 50 cases of myocarditis, you prevented like 12,000 cases, 12,000 cases of, yeah, this was the slide, the last slide I was showing. So if you were to see the males, so because this was seen, myocarditis was seen mostly in boys, in young men, because that's how it's just more common there. So if you see 12,000 COVID-19 cases were prevented, 530 hospitalizations were prevented, 127 ICU admissions prevented, 3 deaths prevented. So if you put those things in perspective, the 50 cases of myocarditis kind of fades away. Not to say that it's not serious, it's just that it was a mild case of myocarditis. Little kids, they had some chest pain, they went to the hospital, they were kept there, they were monitored, they were given some what we call non-steroidal anti-inflammatories, and they didn't have any interventions, and they went home. They're doing fine. I mean, in the long run, if you think like, we don't have, I guess not enough time has passed by to say, is the myocarditis from the vaccine worse, or would COVID-19 cause something, way worse? An MIS syndrome would be way worse. It would be hard. So I think that's what I was trying to say. As far as clots are concerned, that has been described more with J&J vaccine, and that's mostly for young women. So that's not relevant to little kids. I mean, not little, but to adolescents and young people. And that also, the number is like 11 cases in, or 11 cases in a million or something. So the numbers are really very small compared to the risk that you're taking without getting vaccine. So I guess it's risk-benefit ratio is what comes down to it.
Dr. Michelle, one of the questions I've been getting a lot is actually from people who are very excited about getting the vaccine for their kids, and their kids are too young.
Yes.
I keep hearing, when is my kid going to get the vaccine?
Yes.
So I know, of course, there's clinical studies that are underway. I think that the 5 to 12-year-old age group will be the next to roll out. I know there's no set answer to this, but as a specialist, do you have a sense of when we might be able to see authorization for 5 to 12-year-olds?
Yes, I think the last meeting when they authorized the additional dose for the immune suppressed people, that's when they said, I think that data is going to come out end of this year or early next year. So I'm expecting it later this year. So that's what they're projecting. So I hope they're saying later this year. I'm hoping by October or November is what I'm hoping for, because the data is out there. They're working really hard on it. So I think they're getting close.
Yeah.
So not too much longer to wait for that.
Yeah.
Yeah.
And then kind of related to that, one of the questions I've been getting recently, and I'd love to hear your response as well, is parents asking about off-label use of the Pfizer vaccine for their child that's under 12 years old. Once Pfizer vaccine got approved by the FDA, some parents started wondering, well, can my 9, 10, or 11-year-old get it? I've been telling them that the American Academy of Pediatrics is not recommending to do that, because one of the things that they're really trying to figure out is the appropriate dosage for younger children, and likely the dosage will be less than what's given to adults, but would just love to hear your feedback on that.
Yeah, I mean, it's the same. I mean, I'm hearing a lot too, like lots of people are asking the same question, like, my kid's like 11, what's the difference? I'll just do it. But I feel like, again, we are dealing with all these immune issues. Little kids' immune systems are extra strong, extra reactive. So I think it is not safe till it is approved, till it has been studied in a clinical setup, because again, things can happen. So I would recommend not to give it to anyone who's less than 12 right now. It's like, I guess we've traveled this far, we can give it 3 more months, it's coming really close. So I would not recommend giving it, because that's the thing, like, should we give a lesser dose is my concern. That is, I think, going to be my question too, because 6-year-olds are really much smaller than 18-year-olds, so I would not give it. That's what I would say too.
Okay.
I agree.
If a fully vaccinated child gets tested COVID positive, quarantines, and has mild symptoms, what can be the long-term health issues we should be careful about?
So I think the one thing, that's a good question. So most of the breakthrough cases that I have heard or read about is not in children. It's mostly in old adults with immune suppression. That's what mostly we are seeing. So is it happening in children? I guess I don't see kids like as a physician, so I don't think it's happening in children. But the most important thing is if the child gets infected, you know, like I was saying, whenever you have the Delta variant, you are going to be transmitting it around too. So you may have a mild illness, but you will be infectious to other people. So little kids, maybe there are grandparents around, or there are, you know, other immune suppressed, maybe parents are immune suppressed. So I think that would be more of an issue. The child may get better, but then, you know, the child it should be taken in consideration, stay away from the grandparent or anyone else who's sick, so that, you know, you don't go infect someone else. And the other thing that I think is important to remember, which I think I didn't mention, is the multi-inflammatory syndrome that is described. That is something that happens after, mostly it is happening maybe 2 to 6 weeks after a child has had COVID illness. And usually most of these kids have had very mild illness. So there's no way to differentiate if this is going to happen 2 to 6 weeks later. You know, that's something we don't know. So I guess long-term wise, it's hard to say if that can happen. It's rare, but it can still happen.
The question I had was, you mentioned there are some people who cannot take the vaccine in elders, like people who have Guillain-Barré syndrome and stuff like that, because the vaccine may create autoimmune response. So what is your best advice for them? What should they do? Of course, their better halves can take the vaccine, right? Because at least the severe case will be saved for them. But
yes,
what is your advice on that?
I mean, so the thing is, whenever we say if somebody cannot take a vaccine, then you have to think of it like the way you said, everybody around that person should make this kind of what we call herd immunity. They should try to make this cover around that person. Whoever is living in his bubble should try to be vaccinated. And then you have to have the same layered protection of like masking, hand washing, social distancing. If anyone is mildly sick, stay away from them. So it's kind of like whenever you can't vaccinate, you should think of how we were living in the pre-vaccination time. I think it just comes down to that because, there is no other way. I mean, this virus is gonna kind of work its way out till we get to what we call herd immunity, like in the system. So the whole country, it's almost like till the whole country doesn't achieve herd immunity, we will keep seeing like surges and surges, kind of like that. So I feel like for that one person, it's his family members who can protect him the best, I guess. That's the answer. Short answer.
The family members could carry, if they go out, they can still carry the virus to this person, even if the family member is vaccinated with the best vaccine?
People, yes. I mean, there can be breakthrough infections. Yes, that is true. So, you know, any one of us, like mostly the breakthrough infections are happening in people who are immune suppressed, but it can happen to others also. And most of the times it should be mild illness. So yes, when you're saying this one person who is not vaccinated, his wife or husband, the spouse goes out and gets a breakthrough infection, yes, technically they can be infectious at that time, but they should have some symptoms. So they should know when to like separate out from that person.
Okay.
That's like social distancing. Yeah.
Thank you. Of course, Vidya, take over if needed. But the quick one is today, since Pfizer has been approved now by FDA, full approval. Today, if someone had to, tomorrow, if someone had to go and get the vaccine, Pfizer versus Moderna versus J&J, how would you say it's a no-brainer, take the Pfizer because it's a full approval versus J&J?
Yeah.
Especially?
So this is something that, like, I think all vaccines at this time are good. So, you know how we get into these technicalities, is it this vaccine, this number, but you know, if you are living in a place where there is only, you know, X vaccine available, I would go and get it. I wouldn't wait for only the Pfizer vaccine to show up in 6 months because you don't have that kind of time. all vaccines are effective. Whichever ones have been under EUA approval, they are all effective. That's what I would suggest. Like if you, I mean, I don't think most places that, well.
But if
I
all
think,
are available, what if
yes.
all are available? I'm asking a tough question. Yeah.
Yeah,
What if all three are available? Then which one?
The true answer is any of them, what you like, you know, whatever you prefer, you can take. That's
Okay.
the true answer. Yeah.
Awesome.
I don't think,
Thank you,
yeah, I don't think it matters.
Okay. Thank you, Vidya. Thank you.
Yeah.
I'll club 2 questions on increasing immunity for children. Do multivitamins and good nutrition help in increasing immunity against the Delta variant? Dr. Mishra, would you like to add to this or comment about this?
I think this is something like, you know, good nutrition helps for anything. It's not just for Delta variant, it's for any infection, any virus, anything. So I don't think anything is special as far as like eating wise, or, you know, people have their own like herbal remedies, whatever. I don't know. I mean, if you're taking a multivitamin, that's fine. But I think good, healthy nutrition is great. I don't know. I guess Dr. Singh probably gives more advice also, personal advice.
Yeah, no, this is
Yeah.
definitely a question that I've gotten even pre-COVID. You know,
Yeah.
even for my families where their kids are going to daycare and preschool, and you know, they'd get a cold and be okay for a few days and go back to daycare and get another cold. You know, would love to get your input as well, Dr. Mishra. But usually, what I tell people is that yes, there are certain vitamins and minerals that I think do help to boost your immune response. You know, things like vitamin C, vitamin D, zinc. You know, I think that those have been shown to be effective in terms of helping your body's immune response. Another thing that I think we're finding out more and more the importance of is what we call probiotics, you know, all the good bacteria that are in your gut. I think we're learning more and more about the importance of probiotics in terms of your body's immune response. So I do think good nutrition is good because I think that's the best way for your body to get all these good vitamins and minerals and probiotics. But, you know, I think a lot of kids are picky eaters. You know, I know my kids still like do not eat what I want them to eat necessarily. So, you know, in cases like that, I think sometimes giving a multivitamin supplement, you know, just to make sure that you're covering your bases is a reasonable approach.
FDA-approved Pfizer vaccine has been released fully recently. How come it proved down the line there are no side effects? Is there a concern about vaccinating kids?
It's just important to emphasize that when vaccines get approved, even if it's through EUA, they do go through very rigorous testing. That's why we're still waiting for the vaccine to, you know, become available for the 5 to 12-year-olds. It's because they've been doing clinical trials for a while, and they really want to make sure that they follow these kids over a period of time and make sure that it's safe.
Okay, fantastic. Thank you, Dr. Singh. And any news about the booster shot of another vaccine? It's a question by Greta Sheshadri.
Yeah. So, you know, so this is something that is being asked almost for past 6 months. So there is a difference because it's being confused. Like like recently, what was approved was and what we are calling it an additional dose. That is not considered a booster dose. That is being an additional dose for the immune suppressed. And the people who are coming in that category are like solid organ transplant, HIV, and people who are like on steroids or other like disease modified, like, you know, biologics kind of. So it's a very specific category of immune suppressed people, because what happened is for them, even 2 doses of vaccine, they kind of, the antibody response their body generated was 5 to 10% or 5 to 20%. Like if my body generated 96% reaction after 2 doses, their reaction was 5 to 30%. So it's kind of like somebody who didn't even have that response. So for them, it's a different thing because it's not really a booster. It's more like another response to see if it's going to bring it up. So that is an additional dose. So I think that is where it's getting confused because people are thinking it's a booster for everybody, but that is a very special category. And the booster is more for people like front line workers like that, me and Dr. Singh, kind of like or people who live in nursing homes, or, you know, so those are the booster things. So I think the next thing that is, I don't know which one's going to come first, either 6 to 12 vaccination, 6 years to 12 years vaccination, or the booster. I think there is a race. I don't know which recommendation is going to come first. One of them is going to come soon. Both of them, they're working on both of them. So
Yeah.
I'm sure there will be a booster coming, but will it be the same dose? Will it be a little different? You know, I don't know. Those things are still pending. So I don't know yet.
Children bring COVID from home and not likely to get it at school. Recently, Mount Diablo School District had several COVID infections from a teacher. So, how do you comment about the school and home infection spread scenario? What are your thoughts?
So the way it's been seen epidemiologically, yes, the infections mostly come from the home. That is how it has been seen in general, because that's where we spend the most amount of time. So it is true that most of the times the infections are picked up at home. I don't know what the details are about this. I did hear that there was some school, there was a teacher who was infected. I did hear that. I don't know the details on that. So, I mean, picking up one case scenario, and I don't know, I can't talk to that. But yes, historically, most infections are carried from home. I guess Dr. Singh can give his thoughts too.
Yeah, no, I think that's a really good question. Certainly, I've been having a lot of parents ask me, what about the safety of my child going to school right now? And we had a town hall meeting with one of our infectious disease specialists who's over at El Camino Hospital. And just as you're mentioning, Dr. Mishra, what he said is that when you look at the data, because again, we've been through COVID for 1.5 years, we have more and more data. His point was that preschools, daycares, schools, they do not tend to be big spreaders of COVID. The majority of kids who are getting COVID are getting it from home, from people at home that are not vaccinated, or large indoor gatherings with family members and friends, again, potentially who are not vaccinated. So, that certainly does not indicate that this can never happen. There's really very few, I would say, absolutes when it comes to COVID. Mainly what there are trends. And, I think that the trend is that, kids generally do not get infected from other kids or teachers. Are there exceptions? Of course there are. But, overall, I think that schools are safe. I've been recommending to my families that I think that their kids should go back to in-person school. And that goes back to what I said earlier, which is that there's really important, I think, social and emotional benefits for a child being in school. The American Academy of Pediatrics is recommending this. So I think you need to, kind of look at it big picture.
Awesome. Awesome. Thank you, Dr. Singh. We have a very interesting question. Is there any chance to combine flu shots with COVID vaccine?
So I think I'll take, yes. So I don't think so. I don't think there's any data like that. I think both are very different kind of vaccines. And with the flu shot, as you know, every year it's kind of a different mechanism of making. So it sounds like at one point, will it be true? I don't know. But right now, I don't think so. I don't think there is any such move right now. So it would be nice, but I don't think it's going to happen right now.
Yeah.
So,
so this whole study of Spanish flu, and how it applies, like it comes in waves, and then I think eventually it dies down, it damps. So I guess it's going to COVID is going to be like flu at one point, but until then we have to brace up.
You have to, yeah. There is one question that I see from Geeta. I guess, can we take a booster of another vaccine? I think that's an interesting question also. I think what she means is, can we mix and match? So I think there is not much data of that. There's a question, I guess she said, can we take a booster of another one? Like if you've taken Pfizer and then can you take a J&J? I guess that's what, I don't know if that's what she means, but that is being discussed quite a bit. So the studies that have been done on that is mostly in, like in the US, majority of the times it's been the mRNA vaccine. So most of the studies here have been the mRNA, the two, Pfizer, Moderna, and J&J. But in the rest of the world, there has been more AstraZeneca and that kind of adenovirus kind of studies. So what they have seen, some studies, that if you take the AstraZeneca vaccine, And then you take the third one, you take a mRNA vaccine. So the booster response is better. So that's the answer to that. But, these are all data points here and there. I mean, how is that gonna, help us? I don't know yet. So that was the answer to that question.
Okay. Thank you, Dr. Mishra. There's another question regarding some young boys getting myocarditis. How accurate is the study with respect to adults not having the same issue? If there is a difference indeed, what's in a young boy specifically that they get it?
So, it's an interesting thing because myocarditis somehow is seen in young people. It's usually a disease between 12-year-olds to 30-year-olds. That's where, and mostly males. It's not just related to Delta, it's just viruses in general. And why is that? I don't think there is any reason to that. It's just seen like that. So most of the times it's just that age curve. And once people hit 30, it kind of keeps going down to the age of 50. So it's something that is seen with infections. I guess it's to do with their immune response. Like the immune response is so heavy, looks so much that it just kind of causes this myocarditis and pericarditis. So I think it's an immune response. That's the reason why they get it. And why it happens in males, I don't know. I don't think there is an answer to that. And the good thing about this is what I think the reason why most of the people who found this as a reaction to the vaccine, they rushed to kind of report it, was because most of the times, like, for example, if a 20-year-old or anyone, like if a 20-year-old says, I have chest pain, and they go into the ER, and they don't find anything, they find some EKG changes, they'll do a cardiac cath. So I think that's the one thing they wanted to avoid. That's why they wanted to put this information out there, that this may be a vaccine side effect. So once people are aware, then they're not going to rush them to the cath lab. So all that happened to these little kids was they just were put there, they were monitored overnight, they were given some anti-inflammatories, they got better, and they went home. So I think that's pretty much that happened. So
Yeah, and I think another point that I would add to that, which is something that Dr. Mishra said before, but just to kind of emphasize, is that you can't always say that A caused B. It could just be that A and B kind of happened around the same time. And, who's to say if you have 1 million people and a few people get myocarditis, that it was actually due to the vaccine? I mean, it certainly could be. I'm not saying that. But, you can't necessarily say that, it's causation. It could just be coincidence.
mm-hmm.
Yeah, the causation versus correlation, the debate, it's always there. So with that, let's move on to another question. Is there any difference between medicines for COVID and Delta variant?
No, not really.
Not really.
So, I mean, Delta variant is COVID. So I think we're still working on it. I don't think there is any. So first of all, whatever we are treating people with right now, they are also, majority of the treatment is with steroids and remdesivir. That's what we're treating like primarily. And there are some other, there's monoclonal antibodies and some other extremely, unique kind of anti-inflammatory pathway blockers is what we're using. So there is still work going on all that. Is there any difference in the medications? Not really. So I think what has improved is, this may be more technical, but I think in the ICUs, we have developed a way of, we know how to kind of manage people better rather than the traditional way. That's what is different, but there is no difference in the medications as such.
Thank you for that, Dr. Mishra. There's there's sort of a complaining tone here. Why didn't the kids clinical phase 1 proactively happen in parallel with the adult study, as we would have the results, and at least EU approves it, perhaps because they're probably quicker than FDA. So that's a question. So do you have any take on that?
I'm sure people are working on it quite a lot. I wish I knew the answer. I mean, you can only, I think things are going really fast, to be honest, to come up with a vaccine, such an effective vaccine so fast. And I think so many countries came up with so many different I think that in itself is a real big feat of science, that you have effective vaccines so fast. To have them approved for kids, the thing is, you have to go into vaccine development. You have to make it into a science where it's you know exactly how much to give for how much response, and to have the minimum side effects. So those things take time. I mean, you have to enroll that many people. You have to give it. You have to at least give 28 days to see if the response is gotten or not. So there is a time limitation. I don't think it's because kids are less. I think little kids are the most important. So probably they're having time. I think there is a lot of time that is taking in enrolling people because they don't have that many enrollees, you know, because I know even for pregnancy testing, most of the pregnant people are healthcare workers. You know, there are not many enrollees to check for how effective the pregnancy vaccine is. So that's why it took so long. So I don't know if for specific reasons, but I know they're working really hard on it.
Dr. Singh, any comments on Indian vaccines made in India?
I don't have any specific comments. I'm honestly just not as familiar. You know, I'm sure Dr. Mishra knows way more about this than I do, but I will say that, you know, Dr. Mishra, you can kind of chime in that my understanding is that the AstraZeneca vaccine is not as effective against the Delta variant as the Pfizer and Moderna. Is that correct?
So, you know, yeah, I do have the numbers. So let me find my thing. So the number wise, I'll kind of say I mean, just bear with me when I say it, like with the Pfizer. So this is how they kind of saw how the effectiveness would be with the first shot of Pfizer. If you had only one shot of Pfizer, it was like against the Delta variant, I guess is what they're talking about. If it was like 36% after Pfizer, and after the second shot, your response reached 88%. So you have to have both shots of the Pfizer vaccine against the Delta to have 88% response. So they said that an AstraZeneca, after the first response, it was 30%, and after the second response, it was 67%. So, I mean, I guess the 88%, 67% does sound different, but, you know, this is what experts say, that in the bigger scheme of things, if majority of the people living in that area are getting vaccinated and are 67% vaccinated also, if there is herd immunity, it would still work out. So the point is, like, if you had like, I think what the recommendation is, don't get hung up on the 60%, 70%, 80%, like, you know, get the vaccine. But yeah, if you have a choice, then maybe try to go for the Pfizer vaccine. But it seems to me that if everybody has in that area, in one city, if everybody has AstraZeneca, then I think you should still be protected. That's what they're saying, that the 67% in reality does not make a difference. But yeah, by numbers, it seems like it is less effective, but you know, but clinically, it seems like it may not be much different.
What is the take on booster dose again? Kaiser is already giving a booster dose. Is Pfizer and Moderna efficiency going to wear off in 4 to 6 months? It's kind of like you've already answered it, but
Which booster? Again, booster is being used in the wrong term. The booster that they're right now giving is not the booster for everybody. That is for the immune suppressed. So that is why people are getting confused. They're thinking it's for everyone. It's not for everybody. Okay. It's only for immune suppressed, and the immune suppressed category is very specific. So I think it's even like Walgreens is giving it. So if you go to Walgreens, you know, they have a little checklist. So it's very specific.